So we talk about these medications, these maybe device therapies. Do you ever recommend surgery for someone who is diagnosed with this?
With heart failure, yeah. So
Yeah.
our goal is, as a heart failure, advanced heart failure cardiologist, our goal is to focus on the quality of life. We work with these people very closely. It takes a village, what we call, with our pharmacists, trying to improve the compliance, trying to change the lifestyle, medications. We are constantly monitoring them. We have devices, we have people in the office, we have a line of contact that we constantly keep in touch with them.
Yeah.
Despite all this effort, sometimes people progress. They progress to what we call um, advanced heart failure and end-stage heart failure. So at
Yeah.
that, when they come to a point where the medicines, the devices are not working, I think at that point we start thinking about, um, do we offer something else? And we have a lot more to offer beyond this. We use something called IV medications. These are called inotropes. Um, they are constantly pumped into the body through the venous system, because these medicines, they need to be in the system around the clock because of the short acting nature of the medications, and they help improve the symptoms, but they don't alter the course.
Hmm.
And once we know that the patient is advancing to end stage heart failure, then we have a discussion depending on the criteria that if they qualify. We have a discussion whether they want to have a transplant or LVAD. Now,
Yeah.
when we come into realm, usually in US, the cutoff age for transplant is 65 to 70 years, give and take, based on the institution criteria. Some institutes, they have 65 years as a cutoff and 70 as a cutoff. So it depends on the institute. So if we see that they are beyond the cutoff age for transplant, then at that point we say there's something called a durable LVAD, left ventricular assist device. So if the patient qualifies for the criteria, we offer the device, right?
Yeah.
And the it all depends on what the patient wants, and how he perceives quality of life and things like that. And
Yeah.
when we offer somebody a left ventricular assist device, which is a surgical option, right? It's called a destination therapy. That means once they have LVAD, um, they are married to it for the rest of their life.
Yeah.
If they are under 70 or under 65, and if we have institutions that offer, we offer transplant. But the limiting factor with the transplant is you have to wait for a donor heart, right? I mean, for a
Yeah.
LVAD, I can get it off the shelf, and the surgeon can put it in. But for transplant, we have to wait for a donor heart. Although there's a
Yeah.
lot of excitement in that field too, about how we're going to improve the donor hearts and things like that.
Yeah.
So
Yeah. I
yes.
think that whole idea has been always so fascinating to me.